Welcome back. Thanks for joining me on this discussion of stomach gastroesophageal reflux disease in the section of general surgery. Reflux is incredibly common, and in fact, some reflux of the stomach content into the esophagus is physiologic. Therefore, not all reflux is pathologic. Most episodes, however, are very brief. You probably have had a few episodes of reflux yourself after a hard exam or right before one, if one is nervous. Officially, though, the diagnosis of gastroesophageal reflux results in symptoms or complications such as esophagitis, chest pain, or disturbances in quality of life. So, what does that mean? Patients go beyond the intermittent brief episodes of self-contained reflux. These patients have significant symptoms that last for a long time. What are some common history and physical findings? Heartburn, regurgitation. These are common, and in fact, some patients complaining of chest pain, cough, and when they come to the emergency department complaining of chest pain, one gets very worried that it's in fact the patient having a myocardial infarction or a heart attack. It's important to keep that in differential, but common things being common, these patients sometimes present with atypical chest pain. Patients can also describe dysphagia or difficulty swallowing after prolonged esophagitis or inflammation of the esophagus, as well as water brash. Water brash leads to hypersalivation due to the particularly recumbent reflux of gastric contents into the proximal esophagus. Additionally, many patients feel some nausea, vomiting with chronic reflux disease. On laboratories, generally are not very helpful. Your chemistries and your CBCs can be completely normal. So how do we diagnose? Well, we proceed with an upper endoscopy. In this picture of an endoscopy, you show signs of esophagitis. Some patients undergo 24-hour pH monitoring. The gastroesophageal reflux disease is diagnosed when there's persistent disease despite initial treatment, and the pH monitoring records a percentage of time where the pH drops below 4 in the esophagus. Recall that intermittent brief episodes of reflux may be physiologic. Therefore, the overall percentage of time where the pH drops below 4 in the esophagus as evidence or indirect evidence of exposure to gastric content, which, as you know, is very acidic,